Hello everyone, myself Dr. Apurva Sahu and I am an orthodontist. In today's video, basically we are going to talk about the instructions what we give to our aligner patients. I divide the instructions basically into three parts. The first is how to remove and wear your aligners. Second, how to achieve the goal of wearing the aligners for 22 hours. And third is how you're going to clean your aligners. Okay, so let's start this by the first thing, how to wear and remove your aligners. Okay, so whenever you open the set of your aligners, the boxes what you get, every box will have one set of aligners, one upper, one lower. That you have to decide by looking at the front two teeth, which is upper and which is lower. So the two teeth which are bigger will be upper and the two teeth which are small will be lower. Then when you start wearing your aligners, it has to be always from the front teeth. You have to start wearing it up and then go back, and then while removing it, it has to come from the back first and then come in front. Okay, so whenever you're removing it from the tongue side, not from the cheek side. The second instruction which we like to give to our patients is how you can achieve the goal of wearing your aligners for 22 hours. So this seems little difficult, but actually it is very easy. I advise my patients to start every new set in the night time after your dinner and when your brushing is done. After brushing, when you wear your aligners at night, then what happens is that you don't remove your aligner in the whole night time. So this 8 to 9 hours of continuous wear of aligner helps to do the tooth movement which is planned in the aligner. In the morning, when you get up, you don't need to remove your aligner immediately. What I suggest to my patients is that first I ask them, what is your breakfast timing? Suppose if they tell me 9 o'clock. So I tell them that if your breakfast is ready, just 10 minutes before you start brushing. While brushing also, don't remove your aligner first. Yes, don't remove your aligner first. Take your brush, take your paste and brush over your aligner. So that helps to clean the aligners from the outer side. Then you can remove your aligner how I have told you, and then clean the aligner from the inner part where it touches your teeth. So this way you can clear your aligner or clean your aligner from outside and inside, then put it in the box which we have given to you, and then start brushing your teeth for the next 2 minutes. After brushing, wait for 5 to 10 minutes, have your breakfast, and then immediately just clean your aligner with water and rinse once and wear your aligner again. So in the morning, this schedule is the best, what I feel is. In the afternoon time, when you remove your aligner, so the best time to remove your aligner while having lunch is when you go to wash your hand. So we all wash our hands before having food, right? So that time you just remove your aligner in 30 seconds, 40 seconds, whatever it takes, put it in the box, go have your lunch, and after having a lunch, just rinse. You don't need to brush again, and then again wear your aligner back. But in the dinner time, first you remove your aligner, have your dinner, wait for 10 minutes. Then you can brush your teeth, brush your aligner, and then wear it back. While drinking water, while having some juice, you are free to wear the aligner and have your water and juice. You don't need to remove your aligner. Now the best part, since when I have shifted to spark aligners, is that I tell my patients that it is not compulsory to remove your aligners while having food. It is little shocking, I know, but the basic reasons to remove your aligners is that it stains yellow once you have food with it. So it takes the yellow color of the food, especially the turmeric what we use, and then the aligner becomes yellow, and that doesn't look good. Okay, but with spark aligners we have seen that the staining of aligners is almost zero. So this one feature of spark aligner has helped us to increase the timing much more than what we want. So as I told you, you have to wear it for 22 hours. So 45 minutes of lunch, 45 minutes of dinner, and 30 minutes of breakfast timing is usually 2 hours is what basically we tell our patients to remove the aligners. Okay, now if you're not removing your aligner in the lunch time, especially for the children who are in school, they don't need to remove your aligners while having food in your school. You can have your lunch with your aligners in the school time, because I'm pretty sure it is not going to stain yellow, and once you come home you want to remove and clean it once, that is fine. So this thing increases the efficiency of aligners for 1 more hour and some patients are using my aligners for more than 23 years now because of this one change. Is it recommended or no? I leave it to the patient. But I have seen that there is no problem in chewing also, and it doesn't stain also. Now, the third thing is how to clean your aligners. So, which I have already told you now, that how you're going to take care of your aligners. You have to brush it morning and evening with the brush and paste what you use for your teeth itself. You don't need to have a separate brush and paste for your aligners. I also recommend a aligner cleaning tablet to clean your aligners sometimes. You can use it once a week. You have to put your aligner in the container and then take out this tablet which is made up of sodium permanate. Once you put this tablet in the water color will start to change to purple. You can see some effluents coming out. So this is basically the detergent which is there in it. Once the color changes from purple to white, your aligner has got cleaned. The last instruction which I give to my patients is to use this. So what is this? This is a chewy. This is basically made up of nylon, and what does this help is in when the patient wears the upper and the lower aligner, it is fitting very nicely on the patient's teeth. But suppose if 1% the fit is not good somewhere or the other, then with the help of a chewy, the patient bites on it. And I tell them to bite 50 times in 1 minute from left to right. So what does this do is basically if the aligner was not fitting that 1%, it makes it seat properly, and then we are getting a better fit of the aligner which helps to reduce the treatment time eventually. So that is it for the today's video. If you have any other doubts which you want to clear about the instructions of aligners, then feel free to put it in the comment box. I'll be more than happy to help you with the doubts. Thank you so much.